Good morning, Wabash. Chris White graduated from the University of Missouri in 1973 with a baccalaureate degree in nursing. She earned her Master of Science degree in Community Health Nursing from the University of Kansas in 1989. She's been married 35 years to President Pat White, and they have 3 children. Most recently, they have a granddaughter that was born when Dr. White was giving his chapel talk a couple weeks ago. Please welcome Mrs. Chris White with her chapel talk entitled Sound Body, Sound Mind on Peptic Ulcers in the Grand Canyon.
Thank you, Will, for your introduction, and thank you, men of Wabash, for inviting me to speak today. It's truly an honor. In their invitation, the gentlemen of the Sphinx Club asked me to simply tell a bit about myself, perhaps to share some stories. You know the stories you kind of want to hear, so that you might better know me. Like all of you, I play many roles, but I want to focus on one that truly permeates my life and has had an influence on me for a very long time. I recently celebrated my 36th year as a registered nurse. During those years, I've worked hard, learned much, and taken many different paths in my career. One of the benefits I saw when I chose nursing as my profession. I worked in a hospital for many years, primarily in intensive care units. I was director of a college health service for some years. I was a clinical nurse specialist in community health. And most recently, I was a university professor for 18 years and a family nurse practitioner for 15 of those years. Nurses emphasize that our profession is both an art and a science. Indeed, the art and science of nursing has expanded markedly during my almost 40 years of studying and practicing nursing. At the same time, basic science has also changed dramatically over these years. I recall back in the day working in a university research hospital, caring for the acute needs of a class of patients we rarely see today, the gastrointestinal bleeder. We would just kind of call them bleeders back in that time. When these patients appeared in our ICU, we nurses recognized that the quality of the care we gave really truly meant the difference between the patient's life and death. We moved into crisis mode. Here's what we had to do to rescue our patients. We performed what's called a gastrointestinal tamponade at the site of the bleed with a huge tube that was inflated along its entire length after being snaked through the esophagus and into the stomach, into which we would then instill a liter or more of ice-cold saline. Then, very methodically, aspirate it back and remove it, and then begin the process again. Instill another liter of ice-cold saline, remove it, and then instill again another ice-cold liter of saline and remove it. All the time we were doing this, we were checking the patient's vital signs, the flows of IV fluids and blood products, and administering other drugs. We would repeat this process, sometimes for hours over several shifts, until the bleeding ceased. Once that happened, once the bleeding actually stopped, we began another laborious process. We would instill an ounce of Maalox on the hour and an ounce of milk on the half hour. And again, and again, and again, and again, over hours, over shifts, until our patient was stabilized with all signs indicating bleeding had ceased. At the time, medical science believed that peptic ulcer was a psychosomatic disease, a physical illness brought about by psychological stressor or a series of stressors, either real or perceived. I wondered often then about the accepted science of the cause, this mind's perception of real or perceived threat, and its effect, massive, uncontrollable gastrointestinal bleeding. As a nurse, I had cared for hundreds of these patients, and using deductive reasoning, I intuited that perhaps some other factor might offer an explanation for the disease. Many of my nursing colleagues did the same. Many of my patients with GI bleeding did not report undue stress. nor did they exhibit behaviors designated type A. You may know that term, conceived in the 50s, that described a pattern of behaviors that were considered to be a risk factor for peptic ulcer disease and later for coronary heart disease. At the time, type A individuals were described as impatient, excessively time-conscious, insecure about their status, highly competitive, hostile and aggressive, and incapable of relaxation. They were high-achieving workaholics who multitask, drive themselves with deadlines, and are unhappy about the smallest of delays. In fact, you may know a few Wabash gentlemen who may fit this description. Perhaps a few professors. Perhaps maybe even a few administrators. We called them stress junkies at the time. Now, this science has actually been debunked since this era. But I knew then that my patients were really not type A. They were just like me. Many of them were just like me. They were young, they were energetic, they were healthy, and full of hope. Then in 1982, Barry Marshall and Robin Warren made the remarkable and unexpected discovery that gastritis, as well as peptic ulcer disease, is the result of an infection of the stomach caused by the bacterium Helicobacter pylori. This team went on to win the Nobel Prize in Medicine in 2005. The committee noted that the duo collaborated. These were two men of two very different generations, too. They collaborated with, quote, tenacity and well-prepared minds to challenge prevailing dogmas. A pretty good description of a liberally educated person, wouldn't you say? They collaborated with tenacity and well-prepared minds to challenge prevailing dogmas. Gone was the long-held belief that stress and lifestyle were the major cause of gastric peptic ulcer disease. The basic science was forever altered. With their pioneering discovery, peptic ulcer disease moved from a chronic, frequently disabling, and sometimes fatal condition to a disease that could be cured with a short regimen of common antibiotics and acid secretion inhibitors. By 1982, at the time of their discovery, I'd taken a new path in my career and was then director of the Student Health Service at Westmark College, a small liberal arts college in northwest Iowa. I had purposely shifted my focus in nursing from rescuing patients during acute and surgical medical disasters, essentially, what some healthcare policy analysts call downstream medicine, to promoting health and preventing disease in young, healthy, and open-minded college students, practicing upstream medicine, with students kind of like you, just like you. But H. pylori could still inflict havoc in that pastoral-type setting. A strong and vibrant young man with the beatific name of Kent Goodchild, one of three brothers attending the college, a football star, had been visiting me at the health service on several occasions for episodes of vomiting and stomach pain. Kent worked hard, Kent played hard, but his continuing symptoms were troubling. I sent him to a specialist who conducted tests. Kent was diagnosed with stomach cancer, underwent surgery, had chemotherapy, and eventually died less than a year after receiving the diagnosis at the age of 20. In some individuals, Helicobacter pylori also infects the corpus of the stomach. Shortly after the discovery by Marshall and Warren in 1982, their research continued to implicate that the continuous infection of the corpus of the stomach could result in more widespread inflammation that then predisposes not only to ulcer, but also to stomach cancer. The death of a healthy, wholesome, and handsome, Kent was very, very handsome. Many of us considered him an Adonis-type character. An amazing young man, full of life, from an infectious disease, is stunning. After Kent's death, students, faculty, and staff questioned how could this happen. Perhaps we all made false assumption that someone pursuing the life of the mind in college and training the body for fierce competition personified health. Scientific research substantiates the connection between body and mind and body. The ancient Roman poet Juvenal wrote of mens sana in corpore sano, literally, a healthy mind in a healthy body. It's often translated a sound mind in a sound body. The phrase appears in stone on the western facade of the School of Health and Public Education and Recreation at Indiana University in Bloomington, and it is also the motto of many organizations. And some of you may actually be sporting a derivation of this phrase right now. Anima sana in corpore sano, or healthy mind in a healthy body, which are the initials of the name of the sports apparel company, ASICS. I have long believed in the power of the mind-body connection, and I've explored the findings of the scientific field of psychoneuroimmunology that investigates linkages between the brain, behavior, and the immune system, and the implications of these linkages for physical health and disease. Some years ago, after a bout of influenza, I developed the dreaded complication of pneumonia. I was hospitalized with the infection, and over a few days, my condition worsened when I sustained a complete atelectasis, or collapse, of my left lung. When radiographs detected encapsulated pockets of fluid, a thoracic surgeon was called in, and he recommended a thoracotomy, a major surgery requiring a deep, long incision along my back, manual removal of 2 ribs, and the manual withdrawal of these pockets of fluid. I was in my 2nd week of hospitalization. I did not feel good at all, and I really seriously believed that I could not endure the surgery. So I suggested instead we try a chest tube to remove the fluid. The surgeon was not happy about my resistance to surgery. Surgeons never are, because after all, that's their bread and butter. That's why they're called surgeons. My son is a surgeon, and I know all this. He was not a happy camper. However, he did concede to the chest tube, which over the next few days effectively relieved the fluid consolidation in my upper lobe. The surgeon sent me home for a month to regain my strength for the thoracotomy he believed I would need to remove the fluid which continued to collapse my lower lobe. I went home, and with the support of my family, I worked on building my strength. I also practiced positive imagery and focused meditation, using music and laughter as tools of healing in regular 15-minute sessions 4 times a day. Some people might consider that kind of voodoo medicine, but hey, I figured, what the heck? Whether it works or not, it cannot hurt. You may know this already, that I have a very funny husband. And our 3 children are very fortunate that they've inherited his great sense of humor and his comedic timing. They essentially were my therapy. At the end of the month, I went back to see the thoracic surgeon, feeling substantially stronger. When the surgeon viewed my chest films, he was confused. He pointed along the lower edge of my left lung, saying, "What did you do? That fluid, the pockets, they're completely gone. How did you get rid of it?" I told him what I had done. Imagined that fluid as melting butter, slowly and surely drifting and dripping away, and laughing. And he was flabbergasted. He could not otherwise explain why that fluid had completely disappeared. He never charged me for his services, offering me professional courtesy because, as he said, I had taught him two things: to listen to his patients and also to consider new ways for healing. I learned this to be true from my patients as well. I remember well the 24-year-old graduate student who had suffered a severe spinal cord injury after diving into the Iowa River. And he talked to me in the wee hours of the night about what he would do when he could walk again. Central nervous system tissue regeneration was virtually unheard of then, impossible. Science, once again, is changing with the power of current research. But back then, 30 years ago, nurses were strongly cautioned not to give any false hope to those with central nervous system injury. But many months later, I remember vividly the day he walked shakily into the neurosurgery ICU, using arm crutches and beaming from ear to ear, full of stories about his graduate school escapades after months of hard, rigorous rehabilitation. I remember well the 30-year-old new father who was considered open and closed for a metastatic kidney tumor, deemed inoperable because it was also wrapped around his pancreas and his liver. He endured months of chemotherapy at a time when it was not as forgiving as science has made it today. When reopened to check the size of the tumor, gentlemen, this was when technology for CAT scans and MRIs was in its infancy. Surgeons would reevaluate the effectiveness of therapies by reopening the patient. So in that second surgery, the surgeons could find absolutely no evidence of cancer in the abdominal cavity. Back then, they considered him a miracle. Excuse me. Today, science supports the spontaneous regression of certain metastatic renal tumors. Not only does the mind influence healing of the body can influence healing of the mind. There is a substantial body of scientific evidence to support the use of vigorous physical exercise to treat symptoms of depression and anxiety. We know, too, that regular physical exercise can effectively eliminate the craving of addiction to nicotine for smokers who are trying to quit. Yet there are also many instances I have encountered in my nursing practice that truly defy the power of the mind to influence the body and the power of the body to influence the mind. Sometimes there is no miracle. I recall a young woman, a first-time mom with a 2-month-old infant, fighting breast cancer with all her mind, all her soul, and all the social support of her nuclear family and extended families, only to succumb 4 months later when metastases to her spine, liver, and pancreas were discovered. For some years as a nurse practitioner, I treated young women with anorexia. While their bodies were bony protuberances and sagging skin, evidenced by weight appearing on a scale or their reflection in a mirror, these women held mental images of fat rolls overflowing clothes that were too tight, even as they actually swam in clothes much too loose and were literally starving themselves to death. So I'm also not sure whether a strong mind and a strong body in concert actually guarantee health. In fact, I'm certain there is no guarantee of health. In 2003, my entire family drove across the plains to the west, to Arizona, where we set about preparing for a 3-day rim-to-rim hike of the Grand Canyon. We had actually talked about this trip for several years, and we planned the time to coincide with our son's graduation from college and our daughter's graduation from high school. Aspiring a sound mind, sound body approach, we were all prepared well for our excursion. We were fit, having worked on building our endurance and strength for months, and then taking several day hikes on the South Rim before tackling the long hike down 4,000 feet on the South Rim and back up 6,000 feet on the North Rim. The entire family teased me mercilessly that I had packed for every possible emergency or quirk of nature during our hikes. We had hydration packs, salty snacks, high-carb meals, first aid supplies for everything from blisters to major lacerations requiring sutures, that would be me doing the suturing, and agents to counteract the dreaded bite of the sand scorpion. I was ready. However well we planned, we still could not completely predict how each of us would respond to the forces of nature. We were hiking in early July, July 4th to be exact, and on the afternoon of our first day of hiking rim to rim, I began feeling nauseated and a bit goofy, kind of distant symptoms of heat exhaustion. I told Pat what I was experiencing, and he, with some panic in his voice, said, Chris, you're the nurse. What do we do for you? Because you might not be able to tell us what to do. We were hiking in an area called Devil's Backbone, a high, rocky, unshaded trail. I told him that I somehow had to cool off, preferably by laying in the icy creek out of sight way down at the bottom of the ravine. I also do recall telling him that nature didn't care about us just now, so we had to care for each other. I heard Dr. Bost mention last week the importance of social support in healthy relationships. And it was the social support and care my family provided me that saved me 6 years ago in the Grand Canyon. My kids took turns carrying my pack as well as their own down the trail, while Pat provided shade with his own body as we walked. He directed my footsteps, wet my handkerchief, my hair, my hat, and my shirt regularly, and forced me literally to drink water and eat salty snacks until we finally got to a point where I could lay in the water of the Bright Angel Creek. That was truly a significant name at the time. 45 minutes later, I had recovered. When we reached Phantom Canyon, our destination for the night at the bottom of the canyon, it was 130 degrees. We were very fortunate that day, a day when a strong body and a strong mind would not have been enough to protect my health. It took the social support and care of my family and our mutual respect for the power of nature to get us through unscathed. Tragically, 1 year later, a very close friend of our son's, a cross-country teammate at the University of Chicago and an elite runner training for the Olympics, died of exposure in July in the Grand Canyon after becoming lost while hiking with someone she scarcely knew. And just 3 weeks ago, a friend of our daughter's died of heat exhaustion during the Baltimore Marathon. Two brilliant young people, Margaret, a med student at the University of Chicago, and Peter, a biochemistry grad student at MIT, both exquisitely physically fit. Mens sana in corpore sano, sound mind and a sound body somehow was not enough to protect their lives. In February of 2006, I led a team of 14 of my nursing students on an alternate spring break to serve in a free clinic in East Biloxi just 6 months after Hurricane Katrina devastated the Gulf Coast. East Biloxi is a community on a peninsula that was hit twice in the storm. First, the water came from the Gulf, a huge 40-foot tall force, up from the south, followed by a similar wall from the north, back down to the south, from the Back Bay area. In medical parlance, we might say it sustained a contre-coup impact. In plain language, East Biloxi was a physical wasteland, even 6 months later. Its residents, however, were something else entirely. Vulnerable, yet thankful, open, and resourceful. For 10 days, I served as the medical director of the clinic, which was staffed by volunteer physicians, nurse practitioners, registered nurses, and student nurses who had traveled from across the country to be of service to this upstart of a clinic located in a church. Our clinic was virtually the only healthcare resource for residents in a 20-mile radius, because none of the hospitals had yet reopened, and most private practice medical offices remained boarded up, either abandoned or awaiting insurance to rebuild. The experience was transformative for all of us. We had traveled to East Biloxi to offer help, but we came back to South Bend having learned so much more about life after being there. First, a vivid and shocking understanding of the power of nature, but even more, a vivid and heartfelt awareness of the power of humankind, resilient and hopeful when people share human suffering and share human caring. Sound body in a sound mind, wrapped in human caring, perhaps that may be the key to health. Many years ago, a very wise community organizer from the South Bronx told me, "Sweetie, you're real smart. You know a lot. But folks don't care how much you know until they know how much you care." I took her message to heart, and it has pretty much directed my life as a daughter, sister, registered nurse, nurse practitioner, university faculty member, friend, mother, wife. As a nurse practitioner, I've worked in several free and low-income clinics where human caring is the crucial component in interactions between folks who need some health care and folks who can provide some health care. In fact, right now I'm working with a group in our Crawfordsville community to plan and open a free clinic right here in Montgomery County. A friend of mine in South Bend recently asked me why I'm embarking on this. I'm doing it because it is the right thing to do, it is the good thing to do, and because I care. Although the debate over exactly what will comprise healthcare reform rages in Congress, even as I speak to you today, it is inevitable that American citizens will have new access to healthcare services, and that healthcare providers and researchers will be doing their jobs very differently in the near future. Healthcare providers and researchers must recognize that scientific discovery may leap from the imagination and blossom from daring speculation, and that discovery inevitably leads to many, many more questions. They must also accept that science, as a body of knowledge, is provisional. Much of what we thought we knew in the past has turned out to be incomplete or at times simply wrong. Some of you will be those doctors. Some of you may be those nurses. Some of you will be those researchers. But all of us will be consumers of health care, and all of us will face challenges to our own health and that of our loved ones. Be ready for this. Trust what your mind tells you, trust what your body says to you, but also be wary of their individual wisdoms and sensitive to the limitations of each. Be sure to factor in the power of nature, and be sure to embrace the love and support of your family and friends. I'm confident you will be ready because you are in the right place right now, making the right decisions to protect your health and the health of those you love. You are liberally educated men who think critically, act responsibly, lead effectively, and live humanely right now. And I know you will fight for what is right and good because I know, and you know, gentlemen, you well know that Wabash always fights. Thank you.